Welcome to Soft Bites Podcast. Your life, your dentistry. We talk about ways to have more fun and meaning in one of the coolest and most rewarding professions in medicine. Conversations on how to bring awareness, create a healthy workplace, and provide emotional insights to make dentistry a fulfilling activity while making space for one's wonder, creativity, and freedom. Here are your hosts, Manuela and Dr André.
Hello, everyone.
Hello.
Hi, André. Welcome. And
Hi,
today
how
we
are
have
you?
we have a very special guest today in our podcast, Dr. André Mariz de Almeida, which is a friend. I consider you my friend, André. So
I consider both of you guys my friends. So it's a huge pleasure to be here with you guys. Actually, well, it's amazing to be Dr. André. I'm a huge fan of your work, and I'm actually a huge fan of Manuela, of the way you live your life. Dr. André, I'm also a big fan of the way you live your life, but Manuela, I love the choices you make in terms of your life, of the way you choose to. Yeah. So completely, I'm really happy to be with you guys here today.
thank you.
We have a very special guest. It's one of the most known dentists in Portugal, quite differentiated in the area that he works, and he's also a very cool guy. It's a pleasure for us to be here today with Mr. Dr. André Almeida.
Thank
you so much for coming.
Thank you.
So just like Dr. André said, you are one of the most, I don't like to use the word successful because success means something different for each one of us. But I think that you were one of the most recognized dentists in Portugal, and because of your skills and technical skills. And but as you know, we talked a little bit here. We talked about the other part of dentistry. So we're not going to get in the technical part of your work. But I would like to hear from you. I would like for you to tell us from the beginning why you chose dentistry. Was dentistry your first choice? And after that, a little bit about your journey and the part of dentistry that you work on and that you are differentiated for.
Okay, so I'm a very stubborn guy. I think almost everybody is. So I'm very stubborn. So I dentistry was not my first choice at all. So I wanted medicine. I think a very big percentage of people want medicine that end up in dentistry. Maybe not. I think probably you're more used to hear that people. No, I always wanted dentistry from the beginning of my life or from my early age, but now I wanted.
No,
I don't know. Yeah, I think it maybe it's a good story to have. This kind of It's like from early age.
I always wanted this since I was.
Always wanted this. No. Yeah. No. I wanted.
No.
Yeah, I wanted medicine.
In this podcast, we are all in for transparency.
No.
Because actually, we think that truth is much more interesting than fiction. Actually,
and much more easy.
Easy as well.
And you have that in common with Dr. André because you also wanted medicine, right?
Exactly.
Yeah. Okay.
Mm-hmm.
No. Yeah. So I wanted medicine. I come from a medical family. So I was not pushed to medicine. Actually, when I got in dental school, my father was so much happier than I did because so much happier. but then I only so I only enroll or only try to enroll in medical schools. But my parents, so they tried me to say, okay, just put there some dental school, a private one, where I'm still I still teach there. So and that was my last resource. I really thought I was going to get in medical school, but then I completely fell in love with dental school. So I stay there. I did my 6-year dental school, and
what was the part? Sorry to interrupt you. What was the part that made you fell in love for dentistry?
Well, I was a very average student, very average. I kind of made my my course in a very soft way. So
you partied a lot. Is that what you mean?
Yeah, a lot. Actually,
so let's go straight.
No. Actually, I was saying that I organized parties. So I organized.
Oh,
Yes, I organized several parties at that time. I was a PR for several clubs and everything. So yes, but at my 4th year, when I started to treat patients, that was the part I completely fell in love. So and for me, I think that was, I dedicate myself to orofacial pain and to bruxism and I think I do like some aesthetic dentistry. I do like some periodontology. But for me, the most important thing for dentistry is patients. So it's people, is to treat people. That's what I fell in love. When I got in contact with people, and then when I was able to make some kind of impact in people's life, that was when I fell in love. So and that was a game changer for me. So the little things. I'm a big fan of TED Talks. I'm completely in love with TED Talks. And there's a TED Talk which I love, which talk about the everyday leadership, and we always expect leadership to be something great, something like really great, something like, and I say this a lot. That you can make very small things, big moments of leadership. And I think that we do in every minute, every second, very important decisions of leadership. And when you have an impact on someone, and we do that in very different moments, in very different times on our life as dentists, we are real leaders, and we are very important persons in a person's life. So, and that was the moment where I fell in love with dentistry. So I don't know if I fell in love with dentistry or if I fell in love with people, but I think dentistry was the way that I knew I was very important to people, and I could have a meaningful impact with people. So that was the way.
That's so cool.
Yeah.
That's so cool. Actually, I was remembering. I'm going to change a little bit to the next question because I was remembering something. So you work in a very specific area of dentistry, right, or of facial pain, and there's a lot of emotional and psychological and subjective factors involved, isn't it? So it's a difficult field, right? So it's normal that when we talk to colleagues, no, I don't want to have any orofacial pain patients because I rather refer them. And I do some occlusion myself. I mean, we can treat successfully high number of patients, but there's another group of patients that, of course, I have to refer. So you were saying that you felt in love with people. So when you realized that dentistry was your thing, were you immediately aware that you were about to work in orofacial pain? Or you thought that you were eventually going to be like working in aesthetic dentistry or rehabilitation, some sort of more technical, more surgical area of dentistry?
Well,
Not such a medical part of dentistry, because orofacial is it's more of a medical part of dentistry.
Yeah, it is. Well, the first I remember perfectly the first patient. Well, I think I chose it. Actually, I think I believe. Yeah. I believe a lot in. I have a very complicated relation in terms of my very academic and scientific part and the energy part. This is the more
I understand
because I do believe a lot in the way that the energy flows and now I'm going and the way that there's a book by Malcolm, I forgot his name, that's called Blink, which I love, like the first
Malcolm Blink,
which I love it. I do believe in first decision, I do believe in intuition, I do believe, and I do believe there are choices that they go behind you. So my first patient was an HIV positive, the ones that you dress completely at. I don't know if at your university was completely. It's a completely stupid idea because everybody can.
You should treat everybody
the same way. That ones you just know, but that was, and it was a surgical patient, and he was a very unhappy patient. He was not completely safe and completely like in peace with his state. And so it was very simple surgery patient, and I was extracting his teeth, and so it was not the extraction for itself. It was the time that I was talking with him. Nobody wanted that patient. It was the first patient. I had to do anesthesia. I had needles, HIV. So it was complete panic for the first patient, and actually I chose this patient. For me, it makes sense. So this is kind of the way I live my life. I think it makes sense, not for the procedure for itself, for the patient, and for the time I take with this patient for itself. So I think when you said orofacial pain, it's hard. For me, it's very simple. The thing, the procedure or the diagnostic for itself is very simple. If you just get to the people, if you just get into the people's mind, if you connect with the people, that's the difficult part. To treat them, it's very easy. If you get into the people, if you connect with the people, that it's very easy to treat them. That's, I think I'm good in orofacial pain because I can connect with them. It's as simple as that. So I think that's a different. That's my main difference I have with everybody else.
And what I agree with you, and I think we can feel that by knowing you. What were the biggest challenges in your career, either in dental school or after dental school, or when you started lecturing? Now you work in one of the most renowned practices in Lisbon, of Madeira. What were the challenges? And by what you are saying, you are a guy that you not only do not run away from challenges, you search for challenges. I mean, you like to go deep. You like to go where things are harder.
Am I wrong? Them, huh? Because some of us.
Am I wrong?
Well, I
mean, it's not.
I'm super. I think I'm able to live with high anxiety. I'm super. Yeah. I actually, when you guys invited me with this podcast, and when everybody invites me for things, I think that, well, my first, well, I'm not, actually, I'm not the kind of guy to say no, and I never say no. I always say yes. That's the problem I have.
That's not a story.
Yeah. That's the problem I have. But actually, the anxiety completely dominates me immediately. Completely. The human race is the human species. Sorry, is the only one who can be dominated by fear and by anxiety, and that's crazy. So, um, uh, there's a great I travel a lot. I love to travel, and there's a thing I learned in.
We can notice.
There's a thing I learned through my travels in Africa. That guys who are trackers, lion trackers, and everything, and I learn with them this when they go and track the lions, they don't plan a lot. They don't know. They just kind of sit against a tree, and they like enter in a meditative state. They just really focus, really stay actually you look at them and they say, okay, are they sleeping? Are they real right now? What are they doing? Are they lazy? But they just getting in the zone. So I more and more, and that's what you do, Manuela. So they just meditate, and they just try to eliminate fear from their area. So I tend more and more. I tend to do that. So every time I have a challenge, even in my professional day, I tend and eliminate fear. So I really ask, and I even ask wherever. Well, I'm Catholic, but I'm sometimes they call me a prostitute of religion. So because I'm Catholic, but I only go to Buddhism and I go to everywhere. So
of course.
So
you gotta be practical, isn't it?
Yeah. So
you gotta pick the best of each one.
Yeah. So I really try to eliminate fear and try to go also very much with my intuition, and that's how I go and face my challenges. That's the way I go. My first lecture, I will never forget it. At the time, Stilo Italiano, I don't know if that
yes.
It was a very big thing. I don't know if it still is or not, but it was a very it still is. And my lecture was just huge. It was just after one of the lectures, so it was I was I think 20 something, and it was in the Portuguese and Dental Conference. And they told me, okay, there are 900 people at the auditorium. So I think I was not breathing for the first 5 minutes of my conference. And it's impossible, it's impossible. 900 people on our first conference, but it's a story right now, it will be my story. So that's the way, in terms of challenges, that's the way you just have to go. Nobody will do it for you, and it's your story, it's nobody else's story. And that's really cool, when it's your story, it's never going to go wrong, never ever going to go wrong. That's a good thing. It's never going to go wrong. You have to prepare it, of course. But that I tell that to everybody. I tell that to my students. I tell that to my patients. Because if it goes wrong, nobody will know it. And if it goes wrong, even if it goes wrong, you did it. So you get better the second time.
Yes.
So you just have to do it.
Yes,
that's for sure.
Yeah.
Can I just ask something, because I loved what you said. When you say that now that's what you practice when you have some challenges, you eliminate fear, you learn to follow your intuition. That was something that you learned, or that was something that you always had in you? and
No,
that you
I've
perfected
learned.
with time?
I've learned, Manuel. I've learned. I do. I think everybody. I've grown so much. You know. I've. Well. I think I've grown so much in the last. Well, I've grown so much in like last 10 years. I've grown a lot, and I've grown a lot in the last 3 years. I do therapy. I've changed from I have changed from like the three different therapists right now, um, and I think everybody should do it.
Mm-hmm.
Actually,
Mm-hmm.
I think therapy is very important. I think therapy is very important for everybody. Dentistry, it's very hard. It's very hard for us. We are. Um, well, the world is very it's very good. It's very I love to live. I love to live in this world, but it's very hard. It's very tough to live here right now.
Mm-hmm.
So, uh, as dentists, we are. I don't know if we talk. I've seen some of your podcasts. I've heard some of it. I didn't hear everybody, every each one of them, but uh, every 30 minutes or every hour
Mm-hmm.
we are being like pushed and we are being tested and we are being like and so we are it's like really hard for us, so we should have some time to be like analyzed, to be to have like some kind of safe space. What you do, like in terms of mindfulness, what you do, like in terms of like some time for yourself, it's really good. But besides that, uh, 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 you should have some kind of therapy. You should have some kind of time for yourself. You should have somebody to have 1 hour of time for somebody else to hear about you, to hear about your problems, about your fears, about your insecurity, to grow. It's very important. So uh, and one thing I've learned is, if you're the best, because I believe everybody is the best, and I do believe that the potential that you have in you, it's not that I don't believe that you have to be the best in the world, because I think, but I think that sometimes we do expect that too much of ourselves. I do believe that you have to be the best that you can be every day, not the best of the world, but uh, uh, to be the if you're the best, then you have to have somebody that you trust and that can be able to to be trained and to be professional to analyze you. So
Mm-hmm.
I've grown a lot. So answering to your question, and I was losing a little bit myself. Answering to your question, I've grown a lot. So this is something that I've learned, and something that I not only learned from people like you, Manuel, and but also from people that I've observed through life, not only from dentists, but especially from other people, like I told you, these line trackers, or people that I see from other kind of professions, of some other kind of places. So I've learned, and I've learned to defend myself also.
Mm-hmm.
You have to protect yourself also.
Mm-hmm. What you said is absolutely right, and that's why one of the reasons why, maybe the main reason why George and André and I have this podcast, it's because dentistry is a hard job. We live in a hard society nowadays. Dentistry is a hard job. You deal with a lot of emotions with people, so you should be very, of course, have very good technical skills, but you have to add to those technical skills your own development. You have to be well also emotional. You have to work on yourself in order to be able to deliver good dentistry. So I think what you said was that, and I do believe that you talked about intuition. I think intuition is a superpower for dentists, and I think that all dentists have it. But I do think that the ones that do the work that you just said, the work in themselves, are the ones that are able to follow that intuition and to act according to that intuition. Because the ones that don't do the work, they always have, the doubt, should I not? So they are not assertive with that intuition.
And you have to stop. Sorry to interrupt, Abby.
Yeah.
You have to stop sometimes. You really have to stop. It's so important to stop.
Mm-hmm.
Because you're going to do mistakes, and if you're doing a mistake, because we are going to do mistakes, it's impossible not to do mistakes. And if you do a mistake, then you better say, okay, this is not working. You don't have, either you say to the patient, or you just say, okay, this is not working today, so let's make another booking and let's do it tomorrow. It's so important to be honest. It's so important, and especially to be honest and to be good to yourself, because we're talking about mental health is being talked more than ever, and it's so important. You're having rock stars canceling concerts, and I'm so happy that this is happening right now, because if rock stars are canceling concerts, we can cancel appointments. It's so easy. It's so easy. So let's do it. Okay, let's cancel. You cannot see 20 patients a day. You cannot see it cannot happen. You're not at the top of your game. You're not. It's impossible to because you're dealing with patients. You're being analyzed every 30 minutes. Don't forget about this, because my students, they get very stressed when I say, okay, you have a test next week, but they don't forget that they're being tested for their lifetime. They're being tested every 30 minutes or every hour or every 2 hours for the rest of their life. This is dentistry. And I'm sorry to break this news to you, but this is happening, and so you have to be on the top of your game in terms of your mental health and in terms of your job. So this is very, very important, and it's really cool. Dentistry is really cool, and orofacial pain is cool. Periodontology is cool. I do have fun. We are, all of us are very lucky to work on this field. But I talk with some colleagues to say, okay, I don't feel like working today, so don't work. Just cancel it, and that's it. Tomorrow is another day. My grandmother, which I love her, she had like the most amazing phrase, and she said, okay, tomorrow is another day. And the movie, they said, okay, the sun will come out tomorrow. Tomorrow is just another day. It's so easy. It's like the simplest phrase ever. It's so simple.
So I would like to talk to you about exploring new paths in dentistry, and I think that we can connect this with your choice about not having your own practice. So just like you said, you are very successful, you are very recognized in your work, but you chose, for what I understood, in a very conscious way, to not have your own practice. So you work in different practices. I think that more than one practice. You can tell us that. But and we already talked about this before we start recording, because I wanted I thought that this was kind of if you have 20 years of career like you and you don't have your own practice, I think that people wonder why. So I asked you, is this kind of don't people say an imposition, like when do you open your own practice? So I would like you to tell us also a little bit about your path in dentistry and why you chose not to have your own practice, and if there is in fact a pressure of society for you to, as a successful dentist, to have your own practice.
Yes, like we've talked before. It's I think, well, I can tell you for sure, like every week for sure, I have someone and patients of mine that tells me, why don't you have your own practice? Why don't you set up your own clinic? And this is for since ever. And this is a conscious choice. And I had dinner with friends actually yesterday, and both of them, they are very good friends of mine. Both of them, they said, "Okay, I open a practice with you. I set up." Neither of them are dentists. They said, "Okay, I'll set you up. I'll invest with you." I said, "Okay, I don't want to, and I don't want to." Well, I think I'm very lucky. Well, first of all, and I heard that podcast that Dr André said. Okay, first of all, I'm very I consider myself a scientist. I do love research. So I'm with eggs. Me, so I've just signed a full contract with them. So I think I will end up my career in Eggs Mies. So they wanted me to sign a contract with them forever. So I'm there. That will not stop me from having my own practice, for sure. But I'm very happy at university, and I love to teach. So that for me is a very important thing. But I'm also very lucky to be very well treated where I am. And I also am very lucky, and you also talked about that in your podcast of working with very good people. I work with top of the tops of the dentists. So I love to share knowledge. I love to be able to share patients. I love to be able to share ideas. So I actually don't need to have my own practice. I don't want to be on my cubicle. I don't want to be on my corner. I don't want to, I don't see medicine. I don't see dentistry like this. So I see dentistry as a whole. I see my patient as a whole. I'm lucky enough to work in 2 hospitals. So I before this invitation I got to work in 2 hospitals, I was the big fish in the pond. This does not come from a lack of humility, but I was working with dentists, and it was great, but I was missing something. I was missing to have a whole hospital to play with. Now I have 2 whole hospitals to play with, and I wanted to grow. And so I was invited to 2 hospitals to work in, and I can have everything I want. I have MRIs, I have CTs, I have neurologists, I have everything to work with. I'm working in the sleep department also, which was like, I always wanted this. I want orofacial pain, but I didn't want to get in sleep. But it was impossible to work in orofacial and not work in sleep. So I really tried like a donkey not to get into sleep. But like 4 years ago, it was impossible not to get in sleep. So right now, Eggs Mies is like the first one to having the student getting pre-grad sleep, dental sleep medicine in pre-grad. So and so this I think I'm really such a lucky guy to having all this and don't be close in my practice. So that's why I think I've explained it very well. I don't have my practice, so I think I will never have it. And I'm very well. I also made peace with myself, and this was something I really. Talking about money. Let's talk about money, because talking about money, it's also very important talking about money. Yes. Because it's possible when you're, and also it does not come from lack of humility, but when you're good enough, you can ask for whatever you should earn. So when you're good enough, and if you work as hard as I work, and if you have patience, and you have a patient base, and if you have referrals like I have, then you can actually ask what you want. So that's what I got, and a dentist could actually do this, Then you can actually work exactly like you want in the clinics that you want, because you're an asset. So if you become an asset, you don't have to have your own clinic. If you're an asset, if you have your own patients, if you have your own value, and if you know your value, that's very important. That comes from therapy also. If you know your value, then you can actually ask what you want, and that's really cool. That's really cool. And I've made peace with myself when I was able to give my appointments also in university, where people who cannot afford me in the private clinics can also go to the university and still see me. So that was I was able to make peace with myself in that area. So, but so it's possible. It's possible to, because there's still an idea, and you have to make money. It's impossible. Life costs money, travel costs money, the restaurants cost money, therapy costs money, gyms cost money. So you have to talk about money in our world. So you can make good living working in others' clinics. You just have to be really focused, good, and you have to know your value. That's really important. You just have to know your value and to get paid for your value. That's so important.
Manuel, I think you wanted to add something, right?
No, I just wanted to go a little bit deeper in the question, because I think it's so interesting, because I'm sure that your family and friends see that you enjoy what you do, that you have a good life, that the places where you work, you are happy with it, but there's still that pressure of the society, so it's like a status thing. What do you think?
Sorry, Manuela.
It's almost like the pressure of having kids.
Sorry, Manuela, that pressure is okay. Why doesn't he have a practice? Now, if he had a practice, the pressure would be, why does he have a practice? Why does he keep working? So, so that's the kind of pressure that whatever your choice is, there's always someone that needs to add something.
There's always something. It is. No, it is. I think it's the more and more, Manuel. I think it's the more and more, people want more and more, and society wants more and more. For me, it's quite. People just say, "Why are you in university? Why? Because in university, I don't earn as much money as I do in my private practice. Why do you have meetings? Why are you in some scientific societies? Why do you do research that does give me money? And I say, because I like it. Why do you do volunteer work? Because it fulfills me, and if people just say that, then you have to start separating the people, and then you have to, if the people that you.
But this owning a practice thing, I think it's become dangerous. For example, for young dentists, that their parents can offer them practices, it's like something that comes with, and they feel they are a little bit like pushed to do it, and maybe they want something else from life. So I think it's very, very important to have this example, that yes, you can be a successful dentist, and you don't have to own your own practice to be successful and to feel this fulfillment in dentistry.
Yeah, and actually it scares me a little bit, but it might be in the beginning. It might come from fear.
Yeah, of course.
It can come from fear. I didn't open my practice because I didn't. I wanted to work in this field, and I knew that. So I think you have to go with your gut. I think you just have to really think about it, and you have to know if you're happy or not. Because I know a lot of people who open their practice and they're happy. For me, it would not make me happy at all to open my practice, you know. And if you like some specific area, or then you should think, okay, do you have the team to open my practice or not? Or I want to do everything on a specific field or not? You know, I had a lot of propositions to open. Just like 2 days ago, a guy said, okay, I'll open something with you. And another guy, a colleague, say, I'll open something with you. And, you know, it doesn't make sense at all to me, but probably I don't want to have that kind of, but some of my students, their dream is to open a practice, and they want to do it. Maybe sometimes, Manuel, they have to do it, and they have to open and close it because it doesn't work.
If it's something that you feel that you should do, but if I'm just saying, sometimes don't especially young dentists, not to be pushed into something just because it's something that dentists should do. So
I completely agree with you.
Your gut feeling.
Your gut, that's
André, I really enjoy listening to the last minutes that you were talking, because you were saying something that we have been, both me and Manuel, is really emphasizing here, which is, you know, that dentists, and I'm sure you agree with this, and there's a lot of dentists that feel a little bit trapped in the profession, which means, this is such a limiting profession. I get to do this all day, so it's a very technical profession. But what you just said, it's something that we always keep talking, especially when you are talking about diagnosis and initial examination. I always tell to my students, which is, look at the amazing opportunity that you have with a patient in terms of screening, and not exactly diagnosing a sleep apnea or something like, but screening and evaluating and referring the patient. Do you have any idea of the limitations that some other medical specialties have? For example, let's imagine you were only doing like exams in cardiology or something like that. You have the opportunity to be able to talk to someone, to know them, and actually you may be playing a very important role in diagnosing, as a piece important in the diagnosis of many important pathologies. So I think it's very inspiring to listen to you talk about that, because actually dentistry is not that limiting at all. On the contrary, it's actually a very broadening specialty if you look at it with the eyes open, and if you do your work, if you want to learn, if you want to really take care of your patients. I mean, dentistry is everything but a narrow profession, isn't it?
You know, completely, and more and more. What's happening is the other medical specialties are like craving
for dentists,
immensely for us, and that's really cool. You know, that's really cool. They are completely like
fascinated,
wanting us our help, not only for screening, for treating like sleep apnea, for example. We put like the mandibular advancement devices, and we're treating apneas which were not able to be treated the other way. In terms of screening, we are at university. We're doing like, it's the first study then in Portugal, and one of the first in the world, where we're actually trying to see all of the patients that are entering the clinic. They are actually being screened for sleep apnea. So we as dentists are doing that. So like it's really cool. So not only that, orofacial pain, the amount of people who have headaches, and they are actually not like headaches attributed to like migraines, but they are headaches attributed to and imagine today we have a lot of the periodontology correlated with diabetes there are a lot of things that we are the first ones that can actually check and see, and that can go and refer to other specialties. So they are craving for us.
So it's not. So I think I think it's very important for young people that are listening to us. It's just, this is not a narrow profession. It depends
at all
how broaden your mindset is. It depends on how broaden you can look at the profession. So the profession will give to you what you want from it, as long as if you are willing to put the work in it, isn't it? And I think that when you were talking, I think that there was something that you missed, that you only talked about once, which is, if you work how hard as I work. So, and I'm not saying, of course, that there's a lot of interest compound. What do I mean by interest compound? I mean, if you are in the university, if you start contacting other specialties, other medical specialties, even though there will not be an immediate return, in the long term, the amount of contacts and people that know you and people that trust you, especially, I mean, if you are willing to make contacts with people that are not, that is not something that you can benefit from, you gain trust from them. So they know that this guy is someone that I can trust. And trust, when it's transformed in interest compound in the long term, there's no money that can pay for that. I mean, there's no money that can pay for the amount of trust that other people have in you. Yeah. So when you say that, well, I go to the university, I don't make as much money. Yes, but you gain trust, which is much more important than money.
Yeah, of course.
So sorry, you can comment on that.
No, sorry. No. Yeah, completely. And even if you don't talk in university, but even the patients.
Yes, exactly.
And let's talk in a much smaller sense. Yeah. So even the patients, if you treat them, if you find something about them, if you just say, okay, listen, you have something there, I want you to go to your doctor, and I want you to
get this checked.
Go and see what's happening. Get this check, and then something really bad is going to happen, or you improve your sleep, or you improve your health, or you improve something that happens with your heart or with their lungs or something. And then you have not only the patients, the entire patient's family, their thanks for the entire life, but even the doctor. The doctor will start referring patients to you, and that's that. And besides that, not thinking about the referral part, but also the impact that you have on that life, on that family's entire, also that, and then you feel a little bit, and this may be something that might sound like low key, but maybe you feel really close to medicine, and you have an impact, a real impact in terms of medical field, and you change the entire health, of that person, and then you understand, okay, and then you completely fell in love. And I do feel I actually I think you guys also feel this during your life, but I do feel this, when I take care of, when someone has a pain that lasts for 10 years, and then I simply take that pain away, and that person can smile again, can talk again, can the impact that has, or in aesthetic dentistry, that the person who I can tell you a story about aesthetic dentistry with myself in Africa, actually. When I was there was a girl, and she was starting to look at boys. She had the little stains on her teeth, and she was starting to look at boys, and she could not smile. She will smile with her hand like this, and I did something so simple, like take that two little stains off, put some composite on her front tooth, and when she looked at the mirror, she started crying immediately. And for me, it was like 30 minutes. That's it. And then, well, I started crying immediately also. And that was, I do very much complicated restorations here in Portugal, but I needed to go to Nairobi, Kenya, to feel like a dentist, like a full-on dentist. And this kind of impact, that empowerment that you have, that you have this, you have that guy that has 100 apnea an hour, that can die at any minute, so you just have, like Dr. André said, just have to open your eyes and see what you can do to change someone's life. And actually you can change
you were
life.
Talking a while ago of things outside dentistry. You talked about doing therapy and how important it is, which we agree, of course, that I think that everybody should do therapy. You like TED Talks. I'm sure that you read a lot about how you can be. Yeah. I don't like the expression the best version of yourself, but how deep can you know yourself to choose what you want to be?
Yeah.
So outside dentistry, if you want to call it personal development, what do you think were the tools that helped you? Was it something conscious? Did you search for that? Were you aware of that? Do you want to? Was there something about you that you didn't like that you wanted to change? How was that?
Well, the most important thing that I've changed. You guys remember me? I was like, I've done a gastric bypass like 2 years ago. So I was 200 kilograms 2 years ago, and that was like probably the end and the start, but that was the end of a very important therapeutic process for me. I've been doing therapy for quite some time. I've been changing a lot of things, and the most important thing I've been changing is the way I give myself to everybody, and the way I'm very like pleasing person. So I think, and that's very important in the way I relate myself or I connect myself with people. So it's very important to connect in a very meaningful way, but you have to really step your ground with your patients.
Yes, especially orofacial pain patients, isn't it?
Yeah. So no, but even as dentists, you really have to step. Yeah, you really have to.
Both me and Manuela, we are huge fans of something called boundaries. We are huge, both huge fans, and we talk a lot about that. Yes. Yeah, but that mindset, which was basically what I was asking you, was that mindset of setting boundaries and with patients, and eventually accomplishing the things that you have done. Were there some tools, some insights, some techniques? You talk about therapy and how important it was with you. Was it only therapy? Did you do something else? I mean, did you read a lot? Did you?
No, I've read. Yeah, I've read a lot. There was
traveling has changed you, I'm sure.
No, traveling has changed me a lot. I do like an author who is called Eckhart Tolle, The Power of Now. I really like him. It was important to me. Also, I do like Brené Brown. I like her a lot. But I tend to forget. Actually, I tend to forget the names of authors, so I'm really bad at it. So I write. I kind of. I write. I write what not every day, but I write what was like the thing
You
I've
journal.
learned the most.
Do you have a journaling practice?
Yeah,
Nice.
not a journaling. I don't do it every day, but I like what did I like most, the most important days. So
Nice. The positive things.
and yeah.
And
And I
you
do
know
like
that
that.
in social media you have this huge following. The last time I thought it was like 15,000, something like that. And
It's
there's a lot
14,
of curiosity. There's a lot of curiosity. So can you tell us what's your typical week? And what's your typical week? And how frequent do you go on vacations? How do you choose that? I mean, are you always looking for the vacation? I mean, when you are working, are you focused on your work? What's your typical week during the winter? What's your typical? How do you plan for traveling? How do you do that?
Well, André, I tend to be. I'm a control freak, very big control freak. So I a very controlled week. And so I go to the university two times a week. The rest is clinical practice. I've learned that people who have deeper, stronger, and happier connections are people who are going to live longer lives. So I think, I tend to have. I don't have a lot of friends, but I have strong friends who I love having some early dinners during the week. For me, it's very important, and I'm not a party boy anymore, so I don't go that much.
I don't know. I don't know if I believe that, but okay, let's go on.
No. No, but I do some overposting, so that's why you see some things. So I do some overposting on social media.
I never look. I never do my analysis on shallow things. I think that you like to party. I think that you are a party guy. But yeah.
No. I love to party. I love to laugh. I love to party. I do love sense of humor, so I do love to laugh. No, but I love to have even my and that's important. I like to plan my free time. So and I and even my free time. So I like to plan my dinners. I like to plan where I go on weekends. So I like to plan that. I would love to go more to theaters.
Let me ask you a question. Has it ever happened to you that you wanted to go on vacation and traveling, but because you like to travel and you take, by what I see on social media, to take a lot of time off, which is very good. Was there any episode that one of the practices that you work start to be mad that you were out too often, or the hospitals? And how do you deal with that? You just say, no, this is either you want me like this or I'm out of here. Do you have any episode of that?
No. They try, but they never. They've tried. Actually try, but they never. I think it lasts like 2 or 3 seconds because they see my face and there's no
non-negotiable.
It is what it is. It is what it is. It's not negotiable. I have to be at the top of my game. It's not negotiable.
That's so cool.
And even I'm going to Kenya actually in January. I'm going to do a mission in Kenya for 3 weeks. I've just came from Cape Verde in 20 days. So I'm finishing my biggest lasting PhD in the entire life. It's going for like 10 or 20 years. I don't know if I'm taking my PhD. I have to finish it, but I take like some days a month for my PhD. But I need to be on the top of my game to be able to work. Otherwise, and to be able
that is really inspiring for young people, because when I talk about myself, I mean, I can take the time off, and many people can take the time off because they have their own practice and I'm the boss, so I can organize it, right? But it's so cool to see someone that has purposely chosen not to have a practice and be in such a position, not in an arrogant position, but be having accumulated so much interest compound that people will actually bend to what you think is the healthiest for yourself and for them. And I think this is really inspiring because it is possible. Because we have these preconceived ideas that dentistry, oh, your boss gets angry if you take more than 30 days, oh, you cannot go on vacation for such long periods if you don't have a practice, oh, you are only going to treat teeth, oh, this is very narrowing. I mean, we always have this tendency to keep these things very narrow. And it's very inspiring to hear that you have intentionally created your own lifestyle, isn't it? I mean, that was not an accident. You wanted to be like that. Have you ever written down that? Have you thought about that? How intentional was that?
No, actually, I know exactly what I want. I want exactly what I want to do. I will say I was lucky. I think I'm lucky on the overall.
Yeah.
I think I'm a lucky person, but actually I also make my luck.
Of course.
You know, when I say I'm very control freak, actually I work a lot.
Yes.
On the rest of the day. So I work a lot of hours. I start working sometimes at 8 and finish at 9, sometimes 10.
Yeah.
So sometimes I extend it a lot. And so I'm very productive. I was able, when I say in terms of money, you know, I was able to do my price lists. I was able to, you know, to be productive that way. I don't tend to, so my patients are okay, so you know they're so the and so I do work to be up to the top of my game in terms of being actually you know to in terms of like treatment plans and everything. So I work to be at this level, but I'm not different from anybody else. You know, everybody else can be exactly like this. So I just have to. I just think you have to work on this direction. But right now, this is what I want. This is exactly what I want.
I think that is very. But all those things like money and free time. They come because people trust you. And people trust you because you do things without thinking about money. That's so interesting, isn't it? So money comes from trust, but you get to trust when you do things, when people really understand that you are not only doing things about money. So I think this is something that young dentists and people that are aspiring a career in dentistry, they need to understand that you have to create. We are always on the business of selling something. Either you sell cars, or you sell food, or if you are a dentist, you are always in the same business, which is selling trust. And this is, I think, where it all comes from. So we were talking about social. We were talking about social media, and you are I wouldn't say a superstar, but you are one of the most followed guys. You always have a very, very transparent and positive and authentic manner.
For the ones that don't follow, it's Dr. André Mariz de Almeida.
Yeah, I had to check. Actually, you know, I was very sad when I had to. Well, they advised me to change.
Happy dentist, right?
Yes, you were the happy dentist.
Yeah. You know, exactly. I had 4 happy dentist. Yeah, I had 4 social media advisors that said, "Okay, it's time to change to your name." I was so sad. You know?
Okay, so in social media, I like happy in dentists. Social media, so you have someone that advises you. Is it something completely organic, or do you take it very serious?
No.
How is it?
You know, it started to be what it is right again, what it is right now again. So it started to be just me. Now it is again just me. That's why it's so chaotic again. But there was a time where I had someone helping me, where it started more professionally, which I love her. I hope she's not going to hear this. But it started to be too much professionally, and I didn't like it. Too much posing, and I didn't. It was not me. It was not me. I need to be spontaneous, and I'm not the posy guy. So
I completely get what you're saying. I understand that I do see that tendency when someone starts to help you. They say you have to do things like this. You have to show yourself also outside dentists. You have to do this, and I completely understand that you feel trapped, right?
Yeah, no, and it is I don't need this because it's strange for me, because I don't need this for patients. I want this to help. My main goal is to help to educate patients, also to help and educate colleagues. So I have some videos with also I'll show them, so it has to be free flow. I love to show my traveling. I love to show so. I don't want to be trapped on this. I don't want to be overtaken by this, because sometimes it can be overwhelming. Social media can be completely overwhelming, and I have a lot of friends which are like kind of singers and actors and everything, and I see them, and I sometimes I go, I follow them, and it's too much, So it has to be like really, because I don't need it. My patients don't come from there. I have a lot of requests for
quotes,
appointments
asking for
from
quotes.
there, but yeah, no, but but it's not. I'm really bad at answering messages and everything from there. It's I'm terrible, because I think I'm very like overposted, but I don't answer. I'm very like bad in giving back in Instagram and everything. I just post it and that's it. And I just posted like yesterday. I wanted some restaurants, and I said, please give me restaurants, and I didn't even said thank you to nobody. So I'm really bad at giving back in Instagram. So I don't have nobody now organizing it. So it's kind of my way right now again. So I like it.
Very good.
Yeah, because I think that the ones that like Instagram because I like Instagram. I like to see cool pictures, and nowadays Instagram is turned into this big. It's for business.
It has changed.
Right? So it takes out the spontaneous part of it and the fun part. The fun part of it.
Yeah, and I like to be stupid in Instagram. I like to, if I go out and I might have a little bit much to drink, but I have patience there now. But if I have a little bit to drink, I like to. I like to be able to share something, but then now I have a rule. After midnight, I don't post anything. If you see something after midnight, because I barely have a little bit much to drink, but I tend to control that part. But I at a point I had 2 Instagrams. One professional. It's just stupid. I have to have fun.
But then it's a lot of work. I also
and I have to have fun. Manuel, I have to have fun. Life is I love, like I told you, I love life to life is to be funny, and it's not to, it's to be serious. I'm serious, but don't have to complicate it.
Yeah, and you don't have to be serious all the time.
Yeah, of course.
So just to finish, and there was some beautiful things that were said here today, and thank you for that. But work-life balance is a big thing for dentists. I mean, when they come to me, it's a lot about work-life balance. And you talked a lot about that. You already talked a lot about a lot of different tools that you have to achieve that balance. I just wanted to ask you, and going back to your to the name that you had on social media before, the happy dentist, and you are a happy dentist and you love your profession. Just if you could give some, I don't like to give advices, but if you could give some secrets or some tips or some tools, for dentists to be a little bit better on that balance that they want to achieve, that sometimes they cannot. What would you tell them? How do you for yourself are able to achieve that balance? Because for me, it's just not a simple thing. I mean, work-life balance is a lot of little choices, intentional choices that we make. We have to be very intentional. We also have to have the awareness of how we want our life to be in order to make those choices. But if you could give some tip on how to be that happy dentist that you are, what would you say?
Well, first of all, I think you have to actually stop. I'm a big fan of lists. I tell everybody to do lists, relationship lists. So I love lists. So I think first of all you have to stop and see if you're really happy doing what you are in terms of dentistry. So I think that's the first advice. So take a weekend off, and if you can, do it alone. So no kids, no wife, no husband, no anything. And actually, or 3 days, first day to sleep, and then the other 2 days to make a list and see if you're happy doing what you are. That's the first thing. You have to be happy. You have to, because some days are going to be really bad. You are not going to want to go to work. So first of all, just do this. Second, after seeing if you're happy, working like where in the field are you working. Second, I think you have to plan. I think it's very important to plan your week, and this is not something. This is not like a secret formula. When I say plan your week, it's not planning because your work week is already planned, but plan the days, plan your free time. I think it's very important to plan the time that you're going to be away from the clinic. And if you're tired, forgive yourself and please take a day off. It's so important to take a day off. So yeah, you'll be so much productive if you take a day off for yourself. So and I'm it can be, I think a morning or afternoon it's not enough. I think you should take an entire day off, because the morning and afternoon it's not going to be, you're going to be thinking in something. So take an entire day off. So, and if you take like 2 days off a month, it's not going to be that chaotic. Probably you're going to be saving in some taxes. So do it. So take a day off. So that's really important to do. And when I say plan some free time, so plan some free time even for having a dinner or something during a week. So for me, it was really cool to have this, do it like a date night or some dinner with friends. So it's really important. So or a movie or some theater or some exhibition, or if you get a cool concert on your city, or do this. So deliver your kids to someone. So it's really important. Also take a weekend every month if you can, every 2 months if you can. So that's really cool. I know I'm always talking about free time, but I think it's really important to be happy, to plan your free time. It's very and Manuel, I'm going to talk about mindfulness now. It's during your day, and this is going to be back to my patients. So I always think about you when I say this to my patients, but I always do this also. So every time a patient leaves, or every 2 patients leave, so just breathe, breathe. Just breathe. Put a damn sticker, post it on your computer with the word breathe or the word blow, or just do this, which I do though. Just be in the present, just be present. Just close your eyes for 2 minutes and just breathe, or open your window and feel the fresh air uh, you know between patients. That's super important. If you and if you can, plan also the gym time. If you get the gym time or exercise time, you feel more in control. So it's not a secret formula. I don't know if this was the answer, but this is what I do in my life for being more happy right now. Exactly this is what I do to be more happy. It's very simple. So it's to be sure that I'm on the right field. I have any doubts about it. Free time, plan my vacations, plan my dinners with friends, dinners with family. So meaningful relationships, and that's it. It's very simple. It's very simple.
Yeah. It sounds simple, but then to apply, some of us have difficulty with it. And what I observe in dentists, for example, when we start the mindfulness-based stress reduction program, which is 8 weeks, we start always with the body scan. So which is basically a body awareness exercise.
Yeah.
And it's every colleague until now, it's after the first week that they do this exercise, they become aware of how tired they are.
Yeah.
Because they are completely disconnected from their body. So
Yeah.
because they know that they are tired, but only in their minds. So only when they connect with their body, they feel surprised of how actually tired they are. And I saw this quote, this cool Instagram post, because I love Instagram, that said, and I was looking for it, that says, try this ancient remedy. When you are tired, rest. So I think
Rest,
that's rest.
With no
That's
with
as
no
simple
guilt.
as that. That's it.
And
With
Manuela,
no guilt.
with no guilt. That's so important. With no guilt, just rest with no guilt. If you have to sleep, sleep. If you feel like sleeping, just sleep. It's so simple. No guilt. And also for me, that's what is important. Just sleep with no guilt at all. It's so important. No guilt part.
Yeah, and also I said that you said a very interesting thing that I don't hear it very often, which is when you say I cannot, I cannot, I'm too tired, I cannot do the consultations. Don't do it. Cancel them. And it's very brave for you to say that, because you don't often see dentists saying that.
That's forbidden in dentist dental culture. It's completely
And also what I observe in many dental practices is colleagues going through their day saying, "Oh, I cannot do this. Oh my God, I'm so tired. I cannot do this."
Yeah.
Why do you do this?
Yeah,
Rest,
just cancel it.
Take some time off. So like just you said, take 3 days for yourself. Make a list of things that make you happy. Make a list of things that you do on your daily basis. Cross that list and see what are you doing in your days that make you happy, what gives you energy, what drains you out. But sometimes what happens is that they are in automatic pilot, always in the metaphor of the hamster in the wheel, and they don't have the self-awareness even to rest. They are so tired, they are hurting themselves physically, emotionally, but they don't have the awareness even to stop and rest. Just as simple as that.
And we forget. We are very anxious with everything, and we are very anxious to get to everywhere and to get to vacations and vacation. And it's and then we forget. We forget everything so fast. So take your time. Take your time. I'm doing a very hard work. In really taking my time, and this takes time. Takes time to do this. To take my time. So really, it's just I'm very happy with the new generation. I'm very happy. I think we are dinosaurs compared with the new generation. I'm really I'm really I have great hopes for the new generation. I think they're much smarter than we are. So I hope they are much smarter than we are. I have great hopes.
I think they look upon the older generation and say, look, there's something not right. There's something that needs to be more than this. And I was, when you were talking, I was also thinking about, yes, there needs to be a change on the clinical staff, but on our own choice. But also, I think that leaderships, they need to protect these choices. They need to be able to understand and protect. This is why when we talk, Manuel, about what is the most important thing, is it your team or your patients? I think that we have to shift to considering our team. Of course, it's at different levels, but our team may eventually have a priority over the patients, because when you go in an airplane, when masks drop, they don't tell you to put the mask on the child first. They tell you to place the mask on yourself first, and then you can take care of the child. So I think in dentistry, I think that even leadership, they need to understand that the priority is the team, really. It's not about disrespecting the patient or leaving the patient unattended, but the patients, they need to understand that professionals to work on a very high level, they have their timing and they have their rules and they have their own conditions, because it is what it is.
And imagine, and imagine the value that it is to have a professional at that high level of and he's like that degree of work of high level. You cannot have that professional to be on a burnout situation. You want to be on top level. So if you want to produce that high level quality of service, you have that professional has to be. That's what Google has already understood and everything. They want them to be happy. If your dentist is happy, he's going to produce much more.
And Manuela,
and not even talking
Manuela
about,
is always saying something that I think that we tend to forget, which is dentistry is a high performance profession. It is a really high performance because you have to use your head. You have to make sure that the patient is comfortable. You have to control your temper, even when
very high performance athletes.
Even when things are not going exactly as you want, you still have to calm down yourself, because if you get nervous, the patient will feel it. Like a surgeon, like a general surgeon, I mean, the patient is asleep. He can be singing or talking to the nurses. I mean, you can't do that. You are being observed each and every minute, and you are not cutting hairs. Yes. You are doing something with high responsibility. So that's why Manuel is always saying that dentistry is a high performance sport. So you really need to be on top of your game. And I think that we need to value that more and more.
Yes. So you have to be great shape. So of course, if leaders understand that, and I think if the company understands that, then they'll understand that those are top professionals who have to be really well treated. So
I think things are changing. I think things are changing. I think that I think people are realizing that high volume, badly paid, insurance-based dentistry it's not possible. I mean, you will not have epi staff, you'll not have epi dentists, you'll eventually not have epi patients. And I think that people are realizing that we need to set standards as professionals. And I think that there is a change here. It's going to take a lot of time, of course, especially in a country where there is an excess of professionals. But I think that will slowly we are getting there, because the other options, the other possibilities without doing dentistry that is, you don't need to work in Madeira but you can work with high standards in a small practice, but you have to be honest with the patient. And for you to be honest with the patient, you need time. You need time to be on the top of your game. You need them to respect you. You need to set boundaries. And I think that's the way to go. Yeah.
Dr. André, you said a while back. You said if you have the trust of patients, patients will follow you, and patients will follow you until the end of the world. And that I will assure you of that, you know.
Yeah.
And if you're 20 years old, or if you're 50 or 70, patients will follow you. I will assure you that, you know.
Mm-hmm.
So and of course you have to have some common sense, of course, but patients will follow you. I have patients, and I'm oral facial pain special, but I still have patients that try and do some cleanings with me, you know. They will still come and you know, and I said, okay,
There
I
are
don't do
always
that
the
anymore.
ones that try.
No, but I have to do them because they will not, you know. I have to do. I actually, like this week, I had she's just, you know, she's been with me like for 20 years, and I said no, but I want you to do it, you know, because she started with me, and she's paying way more than she could for doing in the clinic where I started, which was in the insurance clinic. And she comes and you know, and I'm still doing it. So patients will follow you. So if you connect with them and if they trust you, even if you say this is not my field, they will follow you. So it will, if you are able to connect with them fresh out of college, which was my case, then they will follow you. So you don't have to be, you can be at the top of the game fresh out of college. You just have to give them all of you in terms of trust, boundaries, and everything. And they will that's for sure.
This was not on the script, and this is just the last question, because I was wanting to ask you this, because I like to see if I do some occlusion oral facial initial screening when you do initial examinations, when we see something. And of course that we are talking about the emotional part and the subjective part, and the stress plays a huge role, right? And I'm sure that you pay a huge importance to that. I'm sure that you have your own, you dress your own scrub of psychologist, and you have some, I'm sure you don't do a full psychiatrist appointment, but I'm sure that by what I know you want to know the patient, right? I'm 100% sure that you do that. I'm going to tell you what I do, and which brings me the best results. So there's this typical thing that I see in patients that are suffering. But in this case, it is through orofacial pain, and sometimes there's a lot of emotional component there. Typical patient, for example, 20s, and she comes with a mom. And you can immediately see that the mom is answering for them, right? Oh, she's very anxious. Oh, she can't sleep. And I see this pattern of sometimes mom and kid, sometimes husband and wife, sometimes wife and husband. And the most important thing, my first goal, whenever I see a patient that is going through some rough time, either they are with someone or not, is to make them sure that it's okay to be like that. It's like, you are normal. I've been through that. I know many people that have been through that. I mean, you are not a freak. The fact that your mom is telling you that you are anxious does not make you anxious. Whenever there's a mom that says, oh, she's very anxious, I say, well, we are all very anxious, aren't you as well? That's my first, because you can always see there's an imbalance in that relationship, isn't it? When the mom wants to make sure that the doctor knows by her own words that their son is anxious, there's something that's not quite right there, isn't it? And I think that the most important thing is to make sure that the patient, for me, that's what works. This is normal. what you are going through is normal. You've stopped exercising because of the pandemic. You've lost your job. Hey, this is normal. First of all, let's start from zero. We are both the same. That could have happened to myself. That happens to everyone. Okay, so let's see where we are going. This is what I use, and this is what I think that helped me the most, because I think that when you drop to their level and when they understand that what they are going through is normal, and what sometimes the mom is doing or what the wife is doing is not okay, and that they should feel okay, I think that's the place to start with them. Do you agree with that? I'm sure you have much more experience with that, and could you just to finish, tell us some of the techniques that you use and the patterns that you use, and how do you see mental health in patients, and of course that you see a lot of issues in orofacial pain. You could write the whole book on that, I'm sure.
Yes. No. What I usually do, it depends. Actually, it depends exactly on how they get in. When I have like a total dominant mom or husband or wife, the first thing I try to do is I try to identify with the wife or the mom or some. So the first thing I try to do is to dominate the dominant.
You. Okay.
Yeah. So I try
How
to
do you
dominate.
do that?
Yeah. So I try to. So I try to make a connection with them.
Okay. So what you're saying. Sorry to interrupt. So what you're saying, so that people that don't misinterpret this, you are not aggressively dominating them. You are seducing them.
No.
Right?
Seducing them. So yes, completely seducing them. So first of all, so I really try to calm her down and really try to seduce them. Yeah. So that's the first thing, and then I turn to the patient, because if I go and turn to the patient immediately, what I'm going to do, I'm going to have an adversary there, and I don't want an adversary there. So I try to seduce the dominant one, and then I go to the patient. When I have the dominant one already dominated, then I go to the patient. So that's what I do. If I have a worried mom, then I try to make the worried mom or the worried husband more calm, and I really go scientifically. That's the approach. Mm-hmm. So more and more. It all depends. Actually, it all depends on the type of patient I have in front of me. But when talking about dominant persons, because when it happens like that, the dominant ones, I really try to dominate them first in terms of seduction. In terms of those patients, those completely morph patients who don't connect at all with you, then you have to really do that what you told, really try to connect them through similarity, so try to reassure them, try to make them more safe, try to make them more aware of what they are doing, and really try to make the least connection, the little bit of connection.
And do you ever feel tempted, or did you ever felt tempted to give advice outside dentistry to your patients?
No, I always do it. I always do it. I always do it.
Give me an. I'm sure there's a lot of love, heartbreaks, divorces, loss of jobs.
Yeah, I send them to talk with their families.
Really?
I send them to go.
So, for example, let's say there's this guy that has.
You even prescribe meditation apps. I know.
Yeah, I prescribe. Yeah, prescribe meditation apps. I send them to psychology or to coach.
And sometimes you say, for example, let's say you can really find an issue with the mom or the dad that is not, they haven't been talked for ages, and you encourage them, so go and fix that with that person, talk to them. Do you do that?
Yeah, even to their sons.
Really?
Or, I have yesterday, like 2 days ago, I had a French patient, and my French is not that perfect. And I said, okay, my French is not that perfect. And so I started the appointment in French. And
How
I
brave was
finished,
that?
no. The thing is, the lady finished this appointment crying, telling me that her husband died, and that she was very alone. She was in Lisbon. She had to buy a house, and said, okay, no, but you have to go out. You have to go to, and that's ended up giving some restaurants so she could meet people. So that's my appointment. My appointments are like this. That's why I get like 1 hour late at my appointment, 2 hours late, because this is the kind of advice I do. I could tell you a million stories.
And how often do you
give
give your cell phone to your patients?
No, all my patients have my phone. Each and every one of them have my cell phone.
Do they call you at strange hours sometimes?
All of them.
Or text you?
Some of them do. Some text me. Yeah, a lot of them text me. I have messages. Tomorrow I have ladies, and and I have the strangest gifts.
I can imagine.
Gifts like. No, yeah, but it's so, but like really cool gifts, like paintings, paintings, or like car plates with the word smile,
personal ones,
so like really personal ones. So it's really cool. But I have a lady that doesn't talk didn't talk with her son, and now she's talking again with her son.
Cool.
So, and the cause of pain was that, the cause of her pain was that. I have patients who said, okay, I want to kill myself, not one or two, a lot of them. So I have, and that's the cool part, that's why it's so amazing to be in this field. Is you really go
deep into their hearts
mind and hearts, and their hearts, So and it's so cool. Sometimes they flip, and sometimes but then they go back, and then they come back, but it's amazing, and the power that you have, and I hug all my patients, almost all of them. I end up my appointments hugging them, and that's really special. And
that's intense.
And even me,
that's intense, because there's this huge exchange of energy, and it takes its toll on you. I mean, when you give, and it works, because you really feel it. And I think that we talked about this in the podcast, because we as dentists, we see so much people that we become experts in feeling the patient, right? Sometimes even more than any other profession, because we are very close to them. We are touching them. We know how they react to pain. We know how they react to any aggression. We know how they react when we are anxious. So we develop this capacity to feel the patients, as very other few professions do. And I think that, especially in your own case, that you deal with sometimes with such deep emotions, I think that's even more. It's heavy on you.
Yeah. For me, I have a lot of patients who are seeing shamans and like witches and astrologists. So it's really cool. So they protect me. So it's cool. But no, it's really cool, that part. All of them are my patients, which is cool. So I don't even pay anything for them. So they give me energy. So it's cool. But I was telling you a story about actually one of those shaman, and he gave me, like, the other day he came to the appointment and he gave me like 2 crystals to say, okay, no, you're very depleted of energy, so please start wearing these crystals when you go to the appointment. When you go to appointments, you have to, because you're very depleted of energy. So don't do it. It's cool. But I think it's really, I think it's a privilege to be able to be in such a deep connection with all these people, and actually to have this kind of impact and these little things, that can actually, because it also changes me as a person in every every single day. Every single day, I'm completely blessed to there's not a single day which I don't end up my day like really happy to be able to that tired, but like really happy to be able to actually change someone's day. And this is, the power that this gives you. And this is like maybe a little bit of ego. We as dentists, we I don't know
Of
if you
course,
feel this or
of
not, but
course,
we as dentists, we are a little bit of
of
gods.
course.
We have a
Yeah,
little
God
god
syndrome. Yeah,
tendency.
God
Yeah,
syndrome.
yeah.
Yeah.
So and this might be happening like this, but I feel this every day. And so this is so much power that we have in our hands, in our hearts. It's so good, so good.
that was lovely to have you here,
So
André.
much. Yeah, it was. We
It's
we
so
knew
good.
it was
Yeah.
going to be good, but it was better
Thank
than
you,
all the expectations. You said so
thank you.
nice and brave things, which I think they are so much needed in dentistry. I also, like you, believe that this new generation. I have a great faith in this new generation, but I think that we also have to be the change, and us having these conversations and saying these things, we contribute for that change. So thank you so much for saying all the brave things that you said, and for sharing with us how you are able to reach the end of your days, like you said, very happy, that tired, because you need, it's hard work, it's not easy, but happy, and that's possible, and that's what me and George André, we say many times. It's possible
Yeah,
for you to enjoy your dentistry practice.
yeah,
You have to
completely,
be
completely.
very intentional with your choices. You have to be very intentional on your resting, on your time
Yeah,
off. You have to take
yeah,
time off
completely.
of dentistry, not only to rest, but also to boost your creativity, which is very important.
That's so
But
important. Yeah,
yeah, but it's possible to have fun with your dentistry practice. So thank you so much
yeah.
for putting all
Thank
of
you very
that
much.
in perspective, and for showing us that that is possible. So thank you so much, André. It
Thank you,
was a
guys.
real
It's an
real
immense pleasure.
pleasure.
When you invited me, I think, okay, why me? Why me? But then, okay, thank you very much for making me understand why me. Thank you.
Okay, thank you so much
Thank you.
for the ones listening. I hope you enjoyed it as much as we did. And yeah, we'll see you on the next episode. Don't forget that me and George André have a conscious leadership
Yes,
course for the ones that own practices and for the ones that don't own a clinic. Because just like André said in the beginning, we also
Yeah,
believe that every dentist is a
exactly.
leader, not only the ones that are dental clinic owners. But of course, dental clinic owners have a greater responsibility on their team. But it's for everyone, because we believe in this conscious dentistry, and we believe in that yeah, you can have a dentistry practice, just like we talked during this episode. So thank you so much for listening. Thank you, George
Thank you,
André.
Manuela.
And thank you, André. And if you don't follow
thank
André
you.
on social media,
Yes.
go find him, because it's really worth it. And bye bye, everyone. Thank you once again. Bye bye.
André, thank
Bye.
you. Thank you,
Bye. Thank
Manuela.
you.
Bye
Thank
bye.
you. Thank you, Andrea. Thank you, Manuel.